in a letter dated January 24, 2019, addressed to both Minister of Social Protection Amna Ali and Minister of Public Health Border Lawrence, the Guyana Public Service Union had indicated its intention of embarking on an industrial action in February to protest for better salaries and working conditions for health workers. According to President of the Union, Patrick Yard, that decision was made at the Union's Executive Council meeting on January 17. According to this correspondence provided to Nightly News, after many failed attempts by the union to resolve the many issues faced in the sector, the Gpsu was forced to initiate an ultimatum and notice of industrial action to the two ministers. However, it was called off.
There was an impressive response because we received letters from both the Minister of Health to meet as well as the Senior Minister of Social Protection. And those meetings, the delegation was headed by the first Vice President, Ms. Gardner. And we were asked to put a hold on these ultimatums. Anyhow, they had to be given a month's notice according to the law, and that these matters would be addressed. I would wish to state today that so far we are dissatisfied. We are not satisfied. We're far from satisfied with the progress in these matters.
President of the union said that following the last meeting held on January 13, 2019, with the senior public health minister and other delegates, the representatives of the government side failed to honor their obligations. In a letter to Minister Lawrence dated April 8, 2019, the union claims that there were times when only the union's representatives showed up for planned meetings, and sometimes only one or two representatives from the Public Health Ministry were in attendance.
This meeting is called not specifically to deal with that, while that is important. This meeting is called to express our total dissatisfaction in the way industrial relations is being treated in the public service and the public sector. That's what this meeting is called about. Okay? To express our total dissatisfaction. And we called it when we recognize that 20 years ago we had a serious struggle about these matters, and it is almost the same experiences we are having currently.
Meanwhile, its members continue to be at risk, working under deplorable conditions, receiving inadequate remunerations for their services, the union claims. Yard said there is great displeasure regarding some irregularities at health institutions, specifically the Georgetown Public Health Corporation.
This has been reported at the highest level, and we have made our position very clear to correct that position. Apart from that, there is a depreciation in the conditions of service for members of that institution, and we have given an ultimatum. We have been asked to put a hold on it and let us address the issues. There are two teams looking at it, but we're not satisfied that it is being addressed effectively.
The union representative mentioned that this issue, among others, will be taken to the Executive Council of the Gpsu for a comprehensive approach, adding that the possibility of rescheduling industrial action to motivate change.
And if it is the general membership position is to take industrial action, I will lead it. But there is a process in arriving at those decisions. Okay? And I know there's a clear view by many members of the Executive Council, if not all, that we are being provoked. That is a view that exists. You have clearly, at the highest level, a promise to respect collective bargaining.
Reporting for HGP Nightly News, I am Yanis Abrams.